So, welcome to the session on global partnerships with IANPHI. I'm Geneviève Chêne. I'm the former Chief Executive of Santé Publique France, a member of the Executive Board of IANPHI, and I'm privileged to moderate the session this morning. First of all, by sharing some housekeeping information, so participants online, please feel free to use the chat to share comments and ideas related to the discussion that we would like to be as lively as possible. So to ask questions, the online participants should use the Q&A box, and for those who are in the room, of course, you only need to raise your hand. And please do. There is a live interpretation that is available in French, and all sessions of the meeting will be recorded. So the agenda of this very important session, and really I would like to thank our colleagues from Sweden who facilitated the organization. We heard from their Minister of Health yesterday in his speech that indeed many health challenges are global. And by the way, today we celebrate also the World AIDS Day. That's on 1st of December since 1988, which means that big threat needs to be hit hard and durably, of course, to be efficacious. So from the IANPHI side, the question is how we can contribute to strengthening the health system and public health globally. And so this session will be an opportunity to hear for newest information about the EU Global Health Strategy that was released yesterday on the 30th of November from the Commission, as well as to learn about the Team Europe initiative for Sub-Saharan Africa with the aim of strengthening national public health institutes. Then we will hear about the collaboration between Africa CDC and ECDC and all the progress that was made in the past year, and also perspectives and specificities of CARPHA in the Caribbean region, and also the newly established Gulf CDC. So to all the speakers, of course, please be mindful of your time so we can have questions from the floor, from the online audience, of course. And I'm sure that all the audience of the NPHI's directors and representatives, but also partners, will have questions to you all. So I start, and so we have the first speakers are online, and we start with Francisco Perez Canado, who is the senior expert at DG Santé of the European Commission to present the EU Global Health Strategy. So over to you, Francisco.
Thank you very much, dear colleagues. Can you hear me?
It's very well. Thank you.
Can you hear me loud and clear? Thank you very much. Apologies that I am not able to be there physically, but we were literally launching the European Commission communication on a new EU Global Health Strategy all through yesterday, and there was no plane that could get me there on time. But the fact that we're presenting this new initiative to you, to the collective forum of public health institutes, underlines the importance that the EU attaches to public health and to your work in particular. It's a pleasure for me also to be speaking in an event which is being organized in Sweden, because as you know, the next step for our global health strategy to turn into reality is that our member states are going to discuss it and come to what we call council conclusions. This will be done under the Swedish presidency in the first 6 months of 2023. So thanks to Sweden for organizing this or co-organizing this, and we look forward to counting on the Swedish traditional leadership in global health in order to come to very good conclusions from our member states. So what are we talking about in the new EU health strategy? It's really a sea change, and it's a sea change because we're moving, of course, from the very important development-oriented approach that we took in our last strategy in 2010, but we're adapting it to a totally changed reality where global health is no longer something that is useful, but it's something that is essential, not only from an external policy point of view, but to protect the lives and well-being and of our citizens and the stability of our society. So it's taken a much more central role in the discourse and in policy, and the EU wants to step up its leadership at the global stage in order to shape the solutions that global health needs now to the benefit of EU citizens, but citizens across the world. In particular, what we're doing is focusing on two fundamental objectives. First, we are trying to regain the lost ground that we have. We have a massive unfinished agenda. We have sustainable development goals in which we know that we're running behind. And therefore, we must focus our efforts, and we will focus our priorities, our actions, our financing streams in order to regain that lost ground. And the second very important priority will be to really take a quantum leap in global health security. We have to combat health threats with much more comprehensively and effectively than before. So acts around these two priorities our action will develop over the next 8 years. The strategy lasts until 2030 in order to also overlap and see how far we're coming to that very important date from the point of view of meeting the sustainable development goals. What I would like to do now is to be a little bit more granular and tell you a little bit how public health fits into this picture. Public health is mentioned 17 times in the document, basically once every page, and this tells you the importance that we attach to it. And in particular, when we're talking about that work to regain the lost ground in the meeting of the Sustainable Development Goals, we want to go back to basics, and we're going to go back to basics by focusing our firepower on enhancing the level of health for citizens, and basically going to a system, health system strengthening, which tackles the core elements. What we will do is use very much the levers of public health in order to do so. We will focus on first dealing with health determinants, much more than before. That social determinants of health, climate change, environment, all this big package which is really shaping how the burden of disease is developing, and we must pay more attention to it. And secondly, we'll certainly be focusing on the basics, primary health systems, and with a strong emphasis in supporting the role that public health can take. So that is us to the first big objective or priority that I was mentioning before. There, I must say, just for you to have the full picture, that universal health coverage will be our fundamental leitmotif, getting there as fast as we can. And we will be focusing on certain aspects which will attract a lot of priority from our end. Tackling workforce imbalances, fundamental to have functioning health systems, and in particular public health. And then we will be paying particular attention to women, girls, and vulnerable persons. The women and girls dimension can be a fundamental lever also to develop broader health solutions to the entire society. So this will be something where we will be paying particular attention on. Other areas that we will be focusing on as key enablers will be digitalization and research, which will get significant attention as we develop our global health policies over the next 8 years. And this is a pointer also for potential collaboration with public health institutes in your community. There will be many opportunities to collaborate, certainly in regaining the lost ground. but also in the second main priority and objective that we have, which is achieving a quantum leap in health security. And there we are looking at very concrete things. You know very well that we're, of course, negotiating robust international rules in the form of a pandemic agreement right now, and this will be fundamental. But we will also be seeking two very important objectives. First, to craft a well-functioning One Health integrated global surveillance network, and to do this as soon as possible. And their collaboration with public health institutes, as we're seeing, for example, in some of our Team Europe initiatives that my colleagues will talk about later on, the role of public health institutes can and we hope will be fundamental. And also crafting a permanent mechanism that enhances equity in the development of and access to vaccines and other countermeasures. Our focus has been a lot on the vaccines, but up until now, we want to shift that focus to cover also all the necessary countermeasures. And there, in this permanent mechanism, I think that there will be also very large areas of potential collaboration with public health institutes. Just to tell you a couple of more words on other tools that we will use to achieve these priorities. We are going to double down, if you wish, on a support to the WHO as the leading institution in global health. This is fundamental. We need a multilateral system that works, and we need a sustainably financed, strong, efficient, and accountable WHO, and the EU will put all its power in order to be behind that idea. And that should in itself also open opportunities of collaboration also with public health institutes, public health being a fundamental strand of WHO work. In addition, we're going to also try to fill the gaps in global governance which exist. I say this only for you for the record, so you understand what we're looking at. But it would be very important in one sense, and I will come to this when I talk about financing and how we intend to bump up the role of public health and public health institutes horizontally. We'll also try to fight duplication and ensure coherence. And there we really must harness the impetus of global health stakeholders and private initiatives to advance our common objectives. Sometimes this multiplicity of organizations leads to a lot of cacophony, and we must extract the best of our collaboration with them while avoiding that cacophony. And that's something that we have not been doing well before. Most importantly, we will have international partnerships, which will be expanded thanks to our global gateway approach, and the colleagues from INPHI will be talking to you a little bit more on this. And this will be based, shall we say, with a slightly different tune. We will be trying to base this on co-ownership and co-responsibility with our partners to enhance their health sovereignty and their autonomy, but also to make sure that they take all the necessary responsibility. And with this, I would like to spend a word on financing. There are novelties in the way that we're going to finance our approach, but I would like to point the link to public health and public health institutes specifically. We're going to use all the levers that we have, including prioritizing projects where the partners are actually supporting public health and are giving public health institutes the role that they deserve in crafting national health solutions. And we're going to do this in a number of ways. We hope to engage first bilaterally with the partners, and as I was saying, say that we will prioritize collaboration if they support not only in theory or in abstract, but in practice, public health and public health institutes. And we will also try to mobilize, shall we say, the international community. We will be engaging with international institutions that are dealing with development issues, and we will engage with them so that also public health is a core criterion for them engaging robustly with different partners across the world. With this, the European Union wants to use our own model, which we very much believe in, which is that of public health, in order to regain the lost ground on sustainable development goals and combat more effectively than ever before health threats, so that we can arrive at the kind of global health security that our citizens deserve in the EU and the citizens across the world deserve as well. Thank you very much, and I'm open for the 5-minute session questions session that the organizers have kindly told me that will happen now. Over.
Thank you very much, and thank you for keeping on time. So we have really time for questions, probably on the priorities, but also on the implementation of this ambition from the EU. So are there questions in the room? That is very important presentation. No questions, so that was crystal clear, and you all know how this will be concretely implemented. Are there questions online? So, is there a question? Yeah, so if you can stand up, please, and briefly introduce yourself. Thank you.
My name is Shiva, public health expert from Zimbabwe. I think you made a very good point about a big sea change in public health as part of global health development. But I think the word global health also has to change. Shouldn't we include global public health instead of global health? Why I'm bringing up this question is the global health as we know it over the last 20 years, the Global Fund, Gavi, EU, USAID, with a lot of financing has not delivered public health, but has delivered global health. So is it possible to really make a great change in global public health and not continue business as usual, with a lot of money spent on countries, but not really invested in primary health care and public health systems delivery?
Thank you for the question. So Francisco, would you like to address the question?
And thanks a lot to the colleague, because this is an excellent question. And the answer to you is that this is precisely what this strategy wants to do, because we need to go back to basics to solve the health problems on the ground. And for that, you need to focus our investment, our firepower, if you want, in investment and in political actions as well, to support primary healthcare, public health, and also take into account that at the end of the day, health is delivered in communities, and we must adapt to the community environment in order to achieve results. And this is, in our view, by going back to those basics. This is the only way to seriously tackle head-on the massive unfinished agenda that we have in health issues across